All right. What's up, everyone? So I'm Garrett. I'm one of the chief residents at U of R.
Hi everyone, my name is Chelsea. I'm also one of the chief residents.
And I'm Greg. I'm another chief resident. Good to meet you all.
I don't think you have to slide it.
Okay.
It's far enough back. All right. So we're with the University of Rochester. Let's get the slides going. There we are. So there's a nice picture of us. Also pictured is Kenny King, our other chief, who couldn't be with us tonight. And this is just a slide of all of our program leadership. So left to right, we have Dr. Kurt Hauber, our program director, and then Dr. Salim and Paul, our APDs. Kathy, who is now retired, is our program coordinator, but she's working per diem until we hire a new one. And then Dr. Patel is our department chair. All right, so URMC PM&R experience. On the left is our recent interns who just started with us last month. We are a categorical program, meaning all 4 years are combined. So we get to interact with our interns a lot, and I think that's a really exciting part of the program. As well as our intern year is really tailored towards your PM&R experience. It's about 6 months of hospital work and 6 months of outpatient work. And we do a lot of things like cardiology, radiology, endocrinology, things that you're going to experience a lot while you're doing inpatient rehab. We also have a very flexible rotation schedule so that we try to tailor it to what you're interested in. We are now at 6 residents per year, so we are rapidly expanding, and our faculty to resident ratio is very high. We've also had a lot of new faculty hired in the past few months, so we're excited to see a lot of new faces. And then you also get a very high volume of procedures and a lot of early exposure in your PGY2 year to procedures, which I think is really helpful for our program as well. So our inpatient, it's a 31-bed unit split between 2 different units. We see a lot of brain injury, spinal cord injury, and then medically complex patients such as amputees or debility. We also have a consult service where we have a couple of APPs we work with. So you get to see a lot of different people throughout the hospital and see a lot of different types of patients and diagnoses. On the outpatient side, we get a really good mix of kind of a lot of different PM&R topics, and this is our new orthopedic PM&R building that was just built about 1.5 years ago. It's very nice. Everyone thinks it looks like an airport. So we do interventional spine, we do PM&R sports and MSK, we get pain exposure, a lot of EMGs. PM&R clinics is where we see a lot of our hospital follow-ups as well as get a lot of our spasticity management. We also get some experience with SNF and pediatrics. And we also work very closely with a lot of our orthopedic surgeons, and we even do a special rotation as a PGY4 with our orthopedics team, so you get a more detailed exposure of how the surgeries actually happen. And our rotation, so there are 12 months of inpatient, which is required by ACGME, but you do most of your inpatient as a PGY2 and then some as a PGY3 and a little as a 4. And the reason we do that is so that you get a lot of outpatient exposure early as a PGY2 to help you kind of determine what your life path is going to be. You know, if you're interested in a fellowship, you get really early exposure. And we provide 6 months of electives, which is the maximum amount that ACGME allows. So you can do a dedicated research month, you can do extra rotations in pain, spine, sports, MSK, or you can make your own elective for whatever you're interested in if you want to get more experience in other things. And again, we just wanted to highlight with our significant outpatient experience that we get a significant amount of procedure numbers.
So with regards to the research track, you can start that your PGY3 year at the earliest and you apply the year prior. And essentially the way that works is that you have a research mentor that you meet with throughout the year, and you have time dedicated throughout the year during your outpatient rotations to work on research. So for example, for me, I have every other week, half a clinic day during my outpatient rotations.
All right, and we have an 18-month lecture series. So every Thursday morning from 8 to noon, you're blocked off. If you're inpatient, you don't have to write notes on that day. The attendings write all the notes. And we cover, pretty much all of your key PM&R related topics. Anatomy and physical exam is a big one that we're currently doing. EMG, ultrasound, Botox, baclofen pumps. We try to be as hands-on as possible with those. So we are currently doing an EMG kind of practice for the fours, and that's, every Thursday morning. And then we get hands-on with ultrasound as well during didactics. And then we do mock oral board practice sessions a number of times throughout the year. We do journal clubs, we have board question reviews, and regular PD meetings and resident seminars too.
So some of the additional perks of the program, so we have 20 vacation days throughout the year. And then we have, in addition to that, 5 days set aside for conferences. We also get $1,000 of reimbursement for those conferences, for travel, travel, hotels during the conferences. We have 3 interview days that are set aside during your PGY3, PGY4 year if you're applying for fellowships or for jobs. 3 additional personal days. We have our board review course reimbursed for the PGY4s, and $300 set aside each year for banks, Q banks, things of an academic nature. And overall, Rochester has a pretty good cost of living, and so our salary definitely goes a long way.
So for faculty, we have a lot of fellowship trained faculty members in a variety of different PM&R related fields. The picture on the right is our pain medicine trained attending Dr. Aktosh with our chief resident Andrew from last year, who's now in Stanford doing a sports and spine fellowship, soon to be followed by the distinguished Chelsea Jacques next year, who just matched, so congrats to her. But yeah, we've got a ton of great faculty here. We have really good learning opportunities, and you have advisors throughout each year that you can talk to at any point. PGY 1 year, it's with your program director, Dr. Hauber. PGY 2, it's with Dr. Salim, who's the APD, or Dr. Paul. And then 3 and 4, you get to choose your own advisor, depending on what your interest is. There's a lot of volunteering teaching opportunities throughout your training here. So SCOPE is a class that we put on for medical students at the University of Rochester. And then there's also MSK Spine teaching opportunities for medical students as well. And then we get a lot of rotating students, both from the U of R and from external rotations around the Northeast area, and actually kind of a broad region. I think someone came in from Arizona recently and all this stuff. Mm-hmm. So there's a lot of teaching opportunities, which is great. And then we have, a lot of community outreach programs as well, the Spinal Cord Injury Fair, the Brain Injury Walk, and our 512 day. That's the 512 is the inpatient rehabilitation unit, and we have a little celebration for our rehab patients on that day as well. Call. This is a great topic for us. So as chiefs ourselves, we don't have any more call for the rest of residency, which is kind of crazy and amazing. For the PGY2s, you're doing most of your weekend call and weekday call. Again, it's a 31 bed unit, so there's only one person on for the weekends. It does make for a busy weekend, but you're only doing it's 6 residents now, so it's going to be Q6 weeks you're on weekend call, which is pretty great. And then throughout the week, you're covering from home, which, variable as far as intensity, but I was kind of a white cloud. I got to sleep through the night. I can't say that was true for everybody, but a little bit of variety there. And then now as a PGY3, you pretty much only do call in July, and then you're done after that for our new PGY3s this year, which is great, and that's partly due to the growing size of our program as well. So that's awesome. And then we have a fun picture of some of our attendings off to the left there. That's cute. And then after residency, so these are our 2 chiefs from last year who both just graduated and went out for interventional sports and spine fellowship. Like I said, Andrew Stevens is in Stanford, and this is Dr. Nick Bender. He is at Emory down in Georgia. And we have sent our residents kind of across the board. Some go into practice, a lot do fellowship, but that kind of varies year to year. For our year, it's like I said, Dr. Jacques going to Stanford, and I'm applying for pain fellowships, which will match in October.
Woohoo!
And then, yeah, fingers crossed. And then Garrett and our other co-chief Kenny are going into practice. So there's a lot of variability, but there's also a lot of options. And I think that's it
A
for
lot of
that.
pictures.
What's that?
And I think it's a lot of pictures.
A lot of pictures.
Yeah.
Oh, beautiful.
So just regarding the wellness event, Kenny is our wellness chief, but I'll give his little spiel. So we have a wellness event, like a designated wellness event twice a year, the summer wellness event and the winter wellness event. The winter wellness event is after SAEs, which is nice. It's a good way to decompress. But also throughout the year, we have holiday parties, different happy hours. One of our former chiefs, and he actually was one of the Spine Fellows, would play gigs with one of our attendings, and a lot of us would go out to watch, and it's a great time to bond with everybody and see everybody. So definitely a lot of wellness events throughout the year. It's also upstate New York, so there's a lot of outdoorsy things to do that we all do together for sure.
Yeah. So yeah, I think we're just going to kind of speed through a lot of these slides because it's just a lot of picture, but this is just showing that all of us really hang out, not just the residents, but even the attendings and families. Every place is going to say that they're a family, but it truly does feel like, we're a big family here. We hang out with each other all the time.
And we talked about Rochester a little bit, but there's, as you can see in the pictures, there's lots of cool opportunities in Rochester. It's a small to medium-sized city, which, everyone's different, but the benefits are low cost of living. We don't have any traffic at any point. It's really easy to find apartments and get outside in nature. I think I contributed some of these nature photos. I'm the class hiker of the group. And if you like the cold, we've got some great skiing here. Some people throw shade at the snow, but I love it. Certainly not all the excitement of big cities, but I think there's a lot of benefits to being in a smaller size city. And I grew up in Rochester and I'm still here, so I certainly love being here as well.
Our pictures show a lot of outdoor events, but there's also a lot of cool indoor places as well. We've done axe throwing, bowling. There's a beercade type of place. This is Craig, very outdoorsy as we see. And this is Kenny, who's not here. He loves sports. He's a big golfer. He's always on the course if he's not at work.
Always.
And our beautiful Chelsea, who's going to Stanford, so exciting. And I love traveling, so this is just a lot of travel pics of me. And then just a lot of pics of our other residents. On the top on the right is our current PGY 3s, and then in the middle PGY 2s. And then on the bottom is a couple of us and some recent grads as well. All right, and this is for your reference later. Follow our Instagram. Chelsea runs it really, really well. There's our website. It has a lot of info. And I think we have about 5 minutes. So should we try to answer some of these chat questions or just move on?
Yes, we do have, I do see one question for your program.
Okay.
Hi, I'm an IMG currently living in the US and applying this match season. I was wondering if there are any opportunities for clerkships or observerships available for international graduates. Thank you.
That's a good question. I don't know specifically with IMGs if that makes it any different, but we do have clerkships for both third and fourth year students, and we do a virtual rotation as well. So it still gets you the experience of kind of learning with a lot of our faculty, even if you're not able to make it on site. I think that should be cool with IMGs. I just don't know for certain. My apologies.
Yeah, that's a good question. I wouldn't be 100% sure off the top of my head if it makes a difference. My assumption would be no, but I'm not entirely sure.
Yeah. If you reach out to our program director, Dr. Haber, or our medical student director, Dr. Snyder, their emails should be either here on our website. They would be a lot more helpful. Yeah.
Perfect. Thank you so much. I see another question here. Is your program reapplicant friendly? Current prelim intern asking for our demographic.
I think currently, no, we aren't taking current interns as far as I'm aware. I think we're just doing for prior PG or like coming into PGY1. But I think if you're a current prelim and want to apply into PM&R and do PGY 1 year again, I think that would probably be okay.
I think part of it depends on whether or not we like have a full class size, because we
Yeah.
just went up to
Yeah.
six residents per year, and so if we have that full, I don't know if they'd accept a reapplying PGY2, just because that would be 7 and that would be too many.
Yeah.
But that kind of brings us to the next question I see. Growing in class size, is that changing your call schedules and what you get exposed to? It definitely changes the call schedule. I mean, we had to do a lot more call. Not that we did a lot of call by any means, but we had to do relatively more call than the current PGY3s and the upcoming PGY2s. So the call is lightening up. And then as far as what we get exposed to, I don't think I've seen any of that. You know, I think one of the benefits of Rochester is that there aren't a ton of fellows running around, and like especially in the outpatient setting, we don't have like a sports PM&R fellow. We do have an interventional spine fellow, but we also have a very large interventional spine department, so we rarely work with the fellow. It's usually us directly with the attending. And as far as scheduling goes, I mean, yeah, I think now as much as ever, we're getting great exposure to everything, so I don't think it's been
Yeah.
affected
And
much.
we've hired so many new attendings that you're still going to get a significant amount of exposure. Like personally, at the end of my PGY 3 year, I had like over 400 peripheral joint injections. So you get more than your fair share of all of your procedure numbers.
Let's wait to see if they have.
Amazing. Okay, I see some more questions here about scores. How important step 2 scores are in the application process? And I also see another question about scores. For DO students, does your program require step 2 or is level 2 only okay?
I mean, I think scores are always going to matter somewhat just because it's one of the few ways that we can objectively kind of stratify students. But I wouldn't say that like if you have below a certain score that we're going to throw out your application. I mean, I've talked to our PD and APD directly, and they're very like holistic with our reviews. So obviously you want to get as good of a score as possible, but at the end of the day, like if you have a lower score, it's not going to automatically toss out your applicant. And then if we require step 2 versus level 2,
I'm not sure.
I honestly don't know. My apologies.
I think it might be institution-wide. I actually have a friend who is a DO radiology resident at the Strong Hospital or University of Rochester, and he did not require step 2, only level 2, and I think that's a university-wide thing. I'm not 100% sure, but I that's what I got.
Thank you. I see one more last question. Is there any opportunities to do global outreach?
As far as I'm aware, it's a possibility. You might have to do a lot of work on your half to like get it set up and get all of the necessary paperwork and legal stuff, but our program is very supportive of us doing like away rotations and even like international. I think they would be supportive if you're able to make it work. It's just going to be a lot of setting up on your end.
Yeah, I think our administration and our PDs and everything are super supportive of what we want to do. They're super receptive to feedback. And so they definitely help you make it happen or support you in making it happen. It's just not something that I have seen, at least so far in our residency, but it's a good question.
Awesome, thank you so much. I believe that concludes our session for University of Rochester.